Welcome to another episode of the Granite List Live, where we discuss all things related to employee benefits and human capital. I'm Lee Dill.
And I'm Sally Pace, and we are joined today by Andy McMillan, who's the EVP of Sales and Marketing for Homestead Smart Health Plans. And Andy, welcome back to the show. We are delighted to have you here.
Thank you so much, Sally and Lee. It's an honor and a privilege to be here with you and certainly to have a voice with your greater audience.
Well, thanks. I know the last time you were on, we talked about Homestead broad strokes, all the different services you all offer. But today we brought you back to really kind of double down on reference-based pricing and to talk about some nuances and things that employers should be looking for when they're evaluating a reference-based pricing solution. Obviously, the first one that comes to mind is savings. Now, we know that certainly reference-based pricing plans deliver more than just savings, and we'll dig into that a little bit. But can we start by addressing the big driver, the savings? Do all RBP plans deliver the same savings to employers, or can you outline some of the differences that could limit employers' savings based on the RBP solution?
Absolutely. And, it's a great question. I think most groups and brokers that are looking at an RBP solution are doing so out of necessity. They're looking to drive savings, and the bigger the group, the larger the potential of savings. And I think that most RBP vendors out there are going to say that they can save employers somewhere between 20 and 30% off of their claims spend related to inpatient, hospital, surgery, outpatient, that type of thing. When you're talking about facility-based type services, that's where the big dollars are, and that's where the big savings are. There is a difference, though, between several types of approaches to delivering the savings as well as access. And those two things go together. One of the more important questions is, what kind of access does a specific employer have? And one of the things that's important to be able to do is run through a geo access that an RBP vendor can see based on their experience with certain hospital systems in various parts of the country. What many RBP companies have done, and we've done some of the same, is develop contracts with hospital systems in various parts of the country. There are some that pretty much present contracts with hospital systems in almost all markets that they're serving. What happens when you deliver that type of a contract, it looks and feels much like a regular network PPO plan. Now, the challenge there is in negotiating those contracts with those hospital systems in a way that would generate savings versus one of the big national carriers like the Blues or United or Cigna or Aetna. In many cases, those contracts do show, and we've got several contracts with hospital systems that provide quite a substantial savings versus a traditional PPO or POS plan with a Blues or a United or a Cigna or an Aetna. But what happens is, in an effort to scramble to get contracts with certain hospitals or certain systems around the country, invariably what begins to happen is you erode the savings opportunity because you're agreeing to a higher reimbursement level than what you would have necessarily been able to negotiate on a case-by-case basis. So what's the trade-off there? The trade-off is that you have access, right? It's easier access. There's no issues from a hospital system or providers or anybody saying, nope, we don't accept that coverage here. And we can talk more about that in a second. So you have this sort of an inverse relationship with savings and access. So the more contracts you have, a lot of times those contracts are reimbursed or set at a higher reimbursement. I'm hoping that makes sense so far.
It definitely does.
So if you're sacrificing savings at the expense of access, one of the questions that I think a lot of groups and brokers need to ask is, what does that mean at the end of the day? If we have a certain population running through hospital systems that we already have contracts with, what does that mean from a savings perspective versus one of the major national carriers? That's very important. We have data on every state in the country with members of ours that have accessed various hospital systems around the country. And we manage that data. We look at that data. We see what our average reimbursement is. We, in fact, were in talks with, I'm not going to say which hospital system, but let's just say a hospital system in the Northeast that wanted a reimbursement level north of 300% of Medicare. Now, traditionally in RBP vendors, including us, are working on a reimbursement model based off of Medicare, targeting somewhere between 125% to 160%. So 300% doesn't sound very attractive and certainly doesn't provide a ton of savings between, say, a Blues, a United, Cigna, or Aetna, and the RBP plan, right? The trick, the key, is having those contracts that are significantly less than one of the Blues from a reimbursement standpoint. And what we do at Homestead is we will provide each group and broker that requests a quote will provide a savings analysis based on the geo access report, where their employees are. We'll look at historical data, and we will also utilize the information that we have on basically what percentage on average we're reimbursing those hospital systems in various parts of the country based on the data that we have from the census and where people are utilizing care. So, you have to have kind of all of these pieces in place in order to get a true, accurate understanding of what the savings potential is. And again, there's a couple different ways to do it. Some will say, yeah, we're going to go with no contracts. What happens there? You run the risk of having more issues up front, access issues or balance billing issues. Okay. I think when we talked last time, one of the things that is a big misunderstanding, most people who aren't in this space, RVP space, will think that the percentage of balance bills that a group might get, if you looked at all the claims, the percentage of balance bills that somebody might get is north of 10 or even north of 20%. And that's just not the case. Industry averages show that it's anywhere between 2 and 5% of total claims. For our book of business, we run at 1.2%. So 98.8% of all of our claims never get a balance bill, which is significant. And I would say that our position and how we approach the market is less focused on regional contracts or local contracts with hospitals and more focused on the back end negotiating. Now, what is that? So we already talked that there's a risk there, right? From an access perspective. And one of the things that we do to overcome that is we have a Clear the Path program. That Clear the Path program puts in motion a huge team of ours to reach out to those providers and those hospitals. So there's no disruption from a transition of care perspective. We reach out to those providers and hospitals that their members, their employees and their families are already utilizing. And we talk to them, we let them know that they have patients, they have membership that is coming onto our health plan. And for us, if there's any questions about this, but this is a legit health plan and we will work with them on making sure they get paid. I know that was a really long answer to a very short question. I hope that we landed the answer there.
Mm-hmm. And using your seesaw analogy between savings and access, tell me if I'm right about this. So your contracted savings is better than a BUCA, And your access, because you have all those contracts, is better than your typical RBP plan. So you sit right in the middle of that. Is that true?
Where we sit is compared to a couple other RBP vendors, I would say that we take the approach of having less contracts out there in order to maximize the savings for the employees and for the employers, the plan sponsors. We offset that through our Clear the Path program, as well as through the proprietary technology that we use on our repricing, as well as the negotiation with those contracts to deliver massive savings compared to Abuka, right? Or the Blues, United, Cigna, Aetna.
Can we shift from the savings side of it, though, to the individual? Because the other thing that we hear a lot, those of us in the industry, regarding reference-based pricing, is that it creates a lot of friction. Can you talk about the member experience a little bit?
Absolutely. The member experience is number one for us. We are focused on the member experience more than we're focused on anything else because we understand and we've been around long enough to see a lot of firms, vendors in this space have focused on other things and left the member kind of out. And there's been a ton of what I would call either customer service abrasion or client management issues, right? So either at the member level, and whenever there's issues at the member level, that will always boil up to the plan sponsor group level. And guess who hears about it? The broker, right? So the way we do this is we focus at the member level with the Clear the Path, with our approach to how we handle and manage balanced bills. We have a network, a physician only network that when an employee goes to see their primary care physician, the access is for basically your primary care level physician access, which is where anybody who's going and having care done, they're likely starting with their primary care physician. So we've eliminated the abrasion by having a network in place already at that level. Where we find the savings, again, it comes at the surgical level or at the infusion level, right? Whether you're dealing with chemo or you're dealing with high cost J code type drugs like a Humira, et cetera. That is where we are going to be working big time to deliver the savings there without sacrificing the member experience. So again, I think historically much of the member abrasion starts just initially when they're going to see their doctor. We've eliminated that. We've got the balance bill protection. So in the case, the 1.2% of the cases of claims that go to balance bill and where hospitals are not accepting the reimbursement level that we've suggested, then we will protect the member for the life of that claim. As long as that claim is open, we will protect that member. There's legislation and different things being pushed around both at the state level as well as the federal level regarding reporting out to credit agencies medical debt. And I think we're going to see something big time change. If it's not already changing right now, it will be changing soon, that would prevent or limit hospitals from sending to credit agencies medical debt. We had a member that was trying to get qualified for a home loan. They were unable to get qualified for it because there was a pretty substantial balance bill that had been reported to a credit agency. Our legal team from our balance billing protection division went after them, sued them, and received an award of $30,000 for the member as compensation for that. So it's no joke the way that we approach it and how vigilant we are for protecting our members.
For sure. And you can really tell y'all have taken steps to make sure that member experience is excellent with not many bumps in the road. You've alluded to data a couple of times and how important it is and how your team has really worked hard to get all the data points and the geo points. Can you talk a little bit about how transparency and visibility into a health plan's cost and usage help employers make smarter decisions?
Absolutely. So the beautiful thing about a RBP plan is the freedom to go anywhere. So there's no network limitations. And every RBP vendor will tell you that. What every RBP vendor also knows, including us, is that there are some hospitals out there in certain geographical areas, or there's certain states that are less friendly to RBP plans. So it's super important to know who the more hostile hospital systems are, or what states may have legislation or case law that wouldn't support, say, an RBP type of plan. All of the data from day one that we've ever encountered from a claim standpoint, reimbursement standpoint, negotiations with systems around the country in all 50 states is accessible to our analytics team. And we are able to help guide and lead groups in the event that they've got a member or membership that would fall into either a geographical area that is less friendly, or that would have hospital system that seems to be more hostile toward the RBP. And we will alert them, and we will work with the member on that to either overcome that and negotiate with those systems, or find, from a transparency perspective, a better solution, an alternative for care that is more friendly and less hostile towards that member.
I'm just kind of curious, looking at your geo data points, are there any groups in the country that really aren't friendly?
There are certain states where case law has made it very difficult for RBP vendors to negotiate with hospitals. A lot of times when you look at the population of the type of employee that we serve the most, it is a lower wage, blue collar type employee, not typically the most healthy, and dealing perhaps with multiple either chronic conditions, or they're standing at the door waiting to walk into the house of a bunch of chronic dysfunction. We're committed to making sure that we can help those folks find the right help. This isn't necessarily like life-changing, but if you look at, we track and review our call center metrics every week. Okay. And there's two very important stakeholders, right, from a call center. Number one is the member, of course. The member is at the center of everything we do. Number two, it is providers, because providers are calling our customer service line, talking to folks to verify benefits, et cetera, every single day. And we have live people that answer the phone, and this is so important. Our average speed answer is 10 seconds. And our goal with our call center is one call resolution. 95% of every single call that we take in is resolved on that first call, and we are never asking a member to make another call. So we'll take that burden on our shoulders, and if we can't get it solved during that call, we will reach back out to the member once we have it resolved.
That is huge. I mean, Andy, I think in an era where customer service seems to be a dying trend, that's a really big deal. And so I really appreciate you joining us today and helping not only talk certainly about the savings that are associated with reference-based pricing, but really dispelling some of the myths that people have or thoughts, and helping educate both the broker consultant universe and employers on what they need to be asking, what they need to be focusing on as they consider moving to a reference-based plan. Thank you for walking us through that, again, very simple but yet so important differentiator about how Homestead handles that customer service experience, because it is huge. We're really proud to partner with you guys, and so grateful that you are a part of our Granite List community. Thank you for joining us today on the show. And thank you again to our listeners for tuning into another episode of the Granite List Live.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.